Honestly, I think a lot of people, including some of my patients, never understood what public health really was because it's just so intangible and it's tangible. And I hate to say it, but to be honest, whatever might be fading, I'm actually hoping there's a much more dramatic light that's being placed on those topics. So I wanted to just offer, for by way of background, I'm a primary care physician. I practice in a federally qualified health center setting in the Washington, D.C. area. In fact, in our region, in the D.C., Maryland, Virginia, the DMV as we call it, we are seeing still a continued increase in cases. So we're incredibly nervous about reopenings surrounding us because we know that states and cities are not hermetically sealed. Just practically speaking, our clinics, we had 13 clinics in this region, and we actually had to close seven of them, both because of reduced volume, as well, a mix in the beginning of reduced volume and actually staff shortages, furloughs, a combination of economic consequences. The truth is that even in a predominantly COVID-19 telehealth friendly environment, we just couldn't keep the money to keep the buildings open. And it wasn't the right thing to do health wise. We don't know coming out of this if we're going to be back to, in fact, none of us think we'll be back to quote normal. We're learning that, we actually can take care of people virtually and it's good. So we're striking a balance. In fact, a conversation I had this morning with our clinic medical directors is like, what proportion of our care should we continue in a virtual manner? We're actually talking literally about virtual dental visits, which I didn't even think was possible, but we're learning how much we can push the limits effectively and with high quality. But we're also trying to strike a balance now on how to bring people in for things we just can't do virtually.